Welcome, and let's look at the lower back. When you have back pain, one of the tendencies is that your lower back tightens up, it grips, and it's a normal thing because we've been told for decades that a strong core protects our back. And when we grip here, your lower back, those QL muscles in the lower back, they will also grip. And one of the telltale signs if you're living with back pain that your QLs are just hyperactive is if you go to step somewhere and the step's a little lower than you thought it was, and then when your foot goes that little, even if it's an extra centimeter further, your lower back goes, right? So we're going to look at how to get that functioning again, because we could stretch it. Stretching doesn't put that functional aspect into the muscle very well. We need to get to a point where we can recognize when the muscle's working and getting it to relax. So I've got a little exercise that we're going to go through. If you've done critical alignment therapy with me, you may be familiar with this one. We're going to grab 2 towels. As you see, I've got 2 towels here, and I want you to fold them into thirds, which means you're folding them lengthways like this. There's one folded into thirds, and then here's the other one. If you have a felt pad, okay, you can use that felt pad and put a thick roll in it. And if you're not too sure what I mean by a thick roll, just use the towels, okay? But what you want to do is have just enough support, but you need a firm level of support, okay? So when you use towels, if you've got a really super plushy towel, it'll be okay for the first little bit, but you do want something with a firm surface, not a foam roller, okay? Foam rollers are way too firm, and there's a very strong risk that you end up re-traumatizing the muscle tissue if you use a foam roller, okay? Please do not use foam rollers for critical alignment therapy. All right, now I'm going to roll up this towel, shoulders away from my ears, and this is going to be nice, firm roll, okay? Now, this is going on the ground. The roll is going to go into your lower back, the area between your lower ribs and your pelvis. Okay, when you lay back, it's a teeter-totter. So I teeter-totter, shoulders down, move around a little bit, get that roll into my lower back between the rib cage and the pelvis. Now, the first thing your brain's going to want to do is drop your tailbone. Don't do that yet. I want you to keep your pelvis lifted, because the first phase of this exercise, pelvis is lifted and you're allowing for some of this pressure from the roll into your lower back. And if those muscles in your lower back are holding tension, you're going to feel this, and there's no point in moving with tension. The whole point of critical alignment is to recognize that there's tension, allow yourself to release some of that tension so you're moving, you're building your strength and coordination into a more easeful state, into a body that can move like this rather than really tight movements, okay? So roll is in the lower back. We're hanging out right here. Critical alignment. First thing we want to do is build this awareness, and it's your lower back. If you are living with back pain, you're going to notice this right off the way, and you're like, of course I'm aware of it, and you kind of get frustrated. Focus in on your breath. I want you to feel that there's a heaviness, that your body's kind of melting with that exhale. Now, as that happens, your tailbone's going to want to drop down. Not moving that yet. What I do want you to notice is that there's kind of a heaviness through your belly, a heaviness into the rib cage, grounding through the feet, If you would like, you can take your knees, bring them in about an inch. Hang out here. Now, through this video, I'm going to be going a little bit faster than I would in a normal class. So at any point, if you want to slow it down, not move as quickly as me, please take your time. Again, the biggest thing is that you recognize that there's an awareness of the sensation, that there's a sense of softness, of relaxation. Then we create movement, and that movement builds strength and coordination. So we have a release in the muscle, a relaxation sensation, and then we build functionality into that muscle, and we build that awareness of feeling that. That's that level of interoception that we want to have in the body. Not a level of hypervigilance and looking for all these little things, just an awareness, that nice umbrella where you can tell if you're holding tension and you recognize it, and if there's something you can do about it at that moment, you do it, or you recognize there's a level of not paying attention at all, not feeling what's going on. We want to build in that two space, those two ends of that space. So hands can be on your lower ribs. You're focusing in on your exhale, and your exhale allows the body to soften. Your inhale is just as important. Breathing into the belly. I want you to feel that there's space. The belly has a bit of a breath in it. The side ribs have some breath. And as you inhale, there's space that happens in the body. And we're laying on the roll, okay? So I want you to visualize that there's some space into your lower back. And then we're going to create a little bit of movement. When we do the movement, if your body is still gripping, holding on to tension, not comfortable, take a breath, recognize that, and then roll to your side. Okay? You do not need to stay here. This is not forcing your body to do this. This is actively engaging, creating awareness. And when the body feels comfortable and your nervous system feels safe, then we create movement. That goes for everything. When you're living with persistent pain, we gradually expose ourselves to things, pay attention, build that awareness, that calm level of awareness. And then we create movement and we build from there. So from here, if we've got a bit of that relaxation, now lower ribs stay in one place. You're going to slowly let your tailbone roll over that roll you're on. Okay, so it's like you're taking your lower back and creating that extension in it, that little back bend. You're only going to your whisper edge. So if you move 1 millimeter and the muscles in your back go, that's where you stop. You do not need to push through this. Getting your tailbone to touch the floor is not going to give you enlightenment. We want to allow the pelvis to move. Then you bring it back up to that neutral position. Now, one thing that does happen when I'm teaching this, and if you watch my upper body, is that my feet will be pushing, and you'll see how my head and my shoulders are moving back and forth. I don't want to do that. I want this upper body to stay still, and the tailbone dips down, and then the pelvis comes up. There's going to be a little bit of movement here, but I don't want there to be a lot. It's mainly this movement down here in the lower back, and you're going to feel your legs doing the work. Now, I want you to drop that tailbone down. From your pubic bone to your belly button, I want you to visualize this abdominal space. And I want you to imagine this is the part that's doing the work. And you're bringing the pelvis back up and you're lowering that tailbone back down. Using the abdominal muscles, but still breathing. You can still have a belly breath as you do this movement. Good. And now you're going to likely notice one side of your pelvis may lower easier than the other. Bring your pelvis back up to neutral. My right side always moves easier. So I'm going to initiate with my left side and imagine my left side is guiding this down. Right side is going to follow. They're nicely attached, okay? Right side's going to follow my left side down. And you can move like that. And just do it a couple times just to build, again, that little bit of awareness and kind of balance, if you will. We're never going to be perfectly symmetrical, but we can notice things and work towards balance. Now, we've been moving the pelvis a little bit, getting that mobility into those vertebral joints in the lower back, which is one thing that when you hold tension in your core and in your lower back, it restricts that movement. And you've heard motion is lotion, right? So we want movement to happen. It doesn't have to be contortionist kind of movement, but we want to allow for some movement to happen in that lumbar spine. Now, when we've got movement in there, and again, if I was taking you through a class, this would be a little bit longer to explore. So as I said before, if you want, just push pause. But we want to build muscle tissue, functional working muscle tissue around this newly created movement. And what we're going to do is engage those lower back muscles. Now, in order to do that, our brain, the next few words that I'm going to say, your brain has an idea of how to do this, but I want you to do it a little differently. So what you're going to do is lift from your belly button. Okay, you can even grab your shirt above your belly button or your pants and lift. And I want you to imagine the pelvis stays fairly low, but it's your belly button that lifts. You're going to feel the muscles that parallel your spine. They're going to contract. And when you feel those contract, because it contracts against the roll, it gives you instant feedback, then you're going to notice that and you're going to soften them. And I want you to do this about 5 or 6 times, lifting from your belly button, feeling how those muscles in your lower back contract, and then you soften them. You contract, and then you soften them. And as you do that, you're going to notice one side might be different than the other. One side may contract faster. One side may release easier. We can work with that. I know my right side loves doing all the work. So my left side, I engage it first. Right side's going to follow along. And then I can let that soften. Okay, so that's bringing in a little bit more of that awareness. Now, I do want you to bring your feet a little bit closer. Again, if you want to play with that for a little longer, push pause. Otherwise, moving into step 4. So step 1 was laying on the roll. First things first, pelvis was up. Step 2 was getting this movement to happen. All right, finding that range of movement using those lower abdominal muscles, not because that's functionally correct, but because the tendency is you have a stronger movement pattern down here with the legs, and I want your core above the pelvis to be engaged with that as well. It's just a little bit more of a weaker movement pattern, bringing more awareness into it. Now, step 3 was tailbone was down, lifting from your belly button, getting those muscles to engage, then soften. You build awareness with that pattern. Step 4 is lifting up into little bridge. Okay, when we lift up into little bridge, again, from your belly button, not tucking the tailbone to lift up. And I want you to notice the difference. It's not that there's anything wrong with it, but again, it's a different movement pattern that when you do live with back pain, tucking your tailbone to lift up sometimes isn't the most comfortable. But lifting from your belly button might not be the most comfortable either, but it's functionally getting that stability into your lower back. And then you lift all the way up. Once you lift up high enough, you're going to take the roll out from underneath you and hang out here for a moment. We want to build this strength in the back of the body. Okay. Now, step 5, last thing, if you'd like to, you're going to push with your feet towards your shoulders, create that little bridge, feel your anchor point at your neck. You're going to keep this arch, lift these ribs up as much as you want, and then just lower your tailbone. So now you have what I call a rainbow. From your tailbone to your shoulders, ribs are lifted. I want you to feel how you can anchor your tailbone. Get that tailbone to push into the floor, just gently. And then you're going to take your hands to your lower ribs and let your lower ribs and upper body soften. That's going to create a little arch into your lower back. Keep the arch in the lower back. Don't let it flatten. Anchor your tailbone. When you anchor your tailbone, what I want you to now do is float your feet. Floating the feet isn't easy. They're going to feel magnetized to the floor. But when you practice this, at some point you're going to be like, oh, and just watch my feet. They just float up off the ground. Okay? They're still just barely touching the floor. I'm not doing this. Okay? That's a different movement altogether. I want you to engage to the pelvic floor. Okay? You float your feet just off the ground. You hang out here. It's not easy, but what you're doing is engaging into the pelvic floor, into the hips, into the lower back. You're creating this functional work, and then the feet come back to the floor. Notice the relaxation, the release, where you just hang here and go, oh, that doesn't feel so bad. Anchor down through that tailbone one more time, and then the feet float off the ground. And they just float. And if you happen to be wearing socks, I kind of say that I want your foot to lift high enough that your sock still touches the ground, but your foot doesn't. That's how I want them to float. Okay? That's floating. At a certain point, if you're holding it, you might start shaking a little bit. That's okay. Breathe. Don't push and force. It should just be like you can hear in my voice. I'm not doing this and gripping and you can hardly hear me. It's just my feet float. And then they come back down. All right. Give it a little wiggle and you can roll over onto your side. And that's it. That's that lower back engagement where we were getting movement into the spine and then we build stability into it. All right? Practice it. Take your time. Don't push through to get everything. Take your time at each one of those steps and progress with patience, not rushing. All right. If you have any questions, please feel free, email me, comment below, and I will see you